Plantar fasciitis and heel spurs. Let's talk about it. Now, plantar fasciitis and heel spurs are not the same thing, but they are related. So I'll talk about plantar fasciitis first and then show how heel spurs stem from plantar fasciitis. So, plantar fasciitis is inflammation of the plantar fascia. On the diagram here, you see the plantar fascia running from the heel to the ball of the foot. The plantar fascia is a ligament type structure that can stretch. Now, the plantar fascia is there to help with the formation of the arch of the foot. And the arch of the foot is there as a shock absorber. It helps to absorb shock when we run, walk, jump, etc. Now, plantar fasciitis occurs when the plantar fascia is overused or overstretched. This overuse or overstretching causes inflammation, and this is why it is painful when you walk. Now, if the inflammation of plantar fasciitis is not dealt with and it goes on for weeks or months, the body then lays down calcium in the inflamed plantar fascia, and this is what leads to the heel spur, and it is the heel spur that is seen on the x-ray. So now you see the link between heel spurs and plantar fasciitis. Heel spurs and plantar fasciitis, they are not the same thing, but they are related in that a chronic plantar fasciitis leads to the formation of a heel spur. Now, usually the size of the heel spur has nothing to do with the severity of the symptoms you experience. It is quite possible to have very large heel spurs but no pain at all. The pain you experience at the heel is due to the inflamed plantar fascia, not the presence of a heel spur. However, keep in mind that if a heel spur grows large enough and downwards enough, pain in the heel can be directly due to the heel spur. In this case, the heel pain is due to direct pressure on the heel spur. So, what are the symptoms of plantar fasciitis? The classic pain pattern for this condition is as you wake up, put your feet on the floor, you feel a heel pain that can be so intense at times that you are forced to walk on your toes. Then, as you walk for a few minutes, the pain subsides or goes away. The pattern repeats when you sit for a while during the day and then get up to walk. Now, the reason for this pain pattern is when you're sleeping, the plantar fascia gets colder and shorter, and hence the attachment point of the plantar fascia at the heel is under maximum strain when you wake up. Then as you walk and the foot begins to warm up, the plantar fascia becomes more flexible. So now the attachment point at the heel is under less strain, so the pain may subside or totally go away. Other symptoms may be pain in the arch of the foot, the feet may feel stiff, possible swelling under the heel, and tight or sore calf muscles. In some cases, people report no heel pain when they are exercising, but when they stop, the pain returns. This is because during exercise, the tissues of the feet are warmer and have more flexibility. So the attachment point of the plantar fascia is under less strain. When exercise ends and the feet begin to cool down, the plantar fascia becomes less flexible and the attachment point is now under more strain. So now the pain returns. What leads to plantar fasciitis, or what causes it? Ultimately, anything that leads to overuse or injury of the plantar fascia is going to lead to plantar fasciitis. So for example, if you are on your feet all day at home or in the workplace, if you play sports, also if you are exercising on a hard or uneven surface, wearing shoes or slippers without proper arch support, walking or standing barefoot, and what is not usually talked about is actually having weak feet. As we age, we naturally lose muscle, and this includes the muscles of the feet. Now, as the muscles of the feet become weaker, the plantar fascia has more work to do. There is a greater likelihood it will become injured or develop plantar fasciitis. This is why treatment of this condition also involves strengthening of the feet muscles. Now, when I say strengthening of the feet muscles, I'm not speaking about general exercise, but actually exercises that particularly target the feet. When the feet muscles are strong, it helps to maintain the arch of the foot and assist with shock absorption. There are also certain conditions that can lead to an inflamed plantar fascia. These are high arches, low arches, obesity, and diabetes. Diagnosing plantar fasciitis. So, in order to diagnose any medical condition, we need to take a history of the symptoms. During the medical history, we would like to know about the symptoms, how long the symptoms have been present, the intensity of the symptoms, and also the pattern of the symptoms. In terms of the physical exam, the doctor will apply pressure to under the feet to determine if and where you feel pain or discomfort. Your ankle mobility will also be tested. You will observe the height of your arches, as well as if your feet overpronate or supinate. Now, typically, X-ray, ultrasound, or MRI are not required unless we suspect another cause of your heel pain, such as a bursitis or a heel fracture. A bursitis is inflammation of the bursa, or a sac of fluid that you see right here. How do we treat plantar fasciitis? In terms of medication, anti-inflammatories and muscle relaxants can be used. Anti-inflammatories reduce the inflammation, and muscle relaxants reduce tension in the muscles of the feet and the calf muscles. If the calf and feet muscles are tight, this leads to inefficient movements at the ankle, and this can put excessive strain on the plantar fascia. Massage can also be used to relax the muscles of the feet, calf muscles, and anterior tibialis. All of this contributes to better foot and ankle movements and reduces tension on the plantar fascia. Performing stretching exercises of the lower legs and feet at a clinic or at home also reduces muscular tension. You should also wear supportive footwear. Your shoes or slippers should have arch support to take some of the load off the plantar fascia. In the same manner, a back support belt takes load off your back muscles when you are treating a back pain. Feet exercises. These need to be done to strengthen the feet to help it to cope with the stresses of your daily activities. You can also wear footwear that stretch the plantar fascia by elevating the big toe. This aims to make the plantar fascia more flexible with time to deal with some of the inflammation. Night splints. These are worn while you sleep or you are just relaxing. It will stretch the calf muscles and the muscles of the feet. Injections. Injections such as steroid and PRP can also be used. Steroids are used to reduce inflammation, and the PRP is used to repair the injured plantar fascia. For a very severe case, a cast or a cam walker can be used. It is used to take pressure off the plantar fascia by immobilizing and cushioning the foot. Dry needling. By inserting an acupuncture needle into the inflamed region, it causes blood to be drawn to the area to help facilitate healing. Shockwave therapy. This uses sound waves to increase blood flow to the targeted region to help with healing. Surgery for plantar fasciitis. This is also an option, but it is a last resort when all other measures have failed. With surgery, the calf muscle can be surgically lengthened. Also, the plantar fascia can also be cut. Prevention of plantar fasciitis. Now, the prevention and treatment of plantar fasciitis overlap. You can routinely perform massages under the feet and the calf muscles with a tennis ball, golf ball, or a muscle roller. Also, stretch these areas on the edge of a stairs or rubber wedges. Attend to any imbalances in the neck, back, or hips, as these can cause you to strain one foot more than the other, leading to an inflamed plantar fascia. If you engage in intense exercise or sports, give yourself enough time to recover and also get massages to help with your recovery. You can also look at using red light and near-infrared light therapy to help with your recovery. Wear the appropriate footwear at home, at work, and at the gym, and replace worn-out footwear as soon as it is practical. So that was just a brief overview on plantar fasciitis and heel spurs. If you want to book an appointment, you can call or WhatsApp 747-5297 or 308-3370. We are located at number 4 Chincuna Gardens in Chinchin Road in Cunupia.
You can tap the description below for all of our contact information.